Hello, welcome everyone. It's Shilpa Bhoraskar here, and I have with me Marchon Schuler. Now, one of the things I've talked over the years about complex cases is that although these cases are so-called complex, the solutions are very, very simple. And one of the best ways to solve complex multi-miasmatic cases is to use simple everyday remedies and remove the blocks to peel these layers one step at a time. So today I have invited my Argentum mentoring member, Dr. Marchon, to share a case study with us that beautifully illustrates this point. And over the years with me, I've seen her work with some of the most complex cases, from acute emergencies to pathological multi-miasmatic cases, but using simple yet powerful tools at stage 1 and 2 pretty extraordinarily. So, Marchon, welcome. And yes, tell us about you, tell us about the case that you have for us, and tell us about, your meeting with this client for the very first time. So over to you.
Very good. Very good. Well, I am a doctor of natural medicine, and I've been in practice since 2000. I originally studied homeopathy, classical homeopathy, for a 3-year program and then a year clinicals. And then I moved on. I had great success with it acutely and emergencies, but I really don't think that I knew what I know now for sure. So I moved on and studied other modalities of natural medicine, nutrition, functional medicine, herbology. And then I circled back around because homeopathy has the answers. And so I started my Argentum mentoring program with Shilpa in 2017, and I am still with her. And I just consider it a master's program moving into a PhD because I am learning so much. Currently, I do have a worldwide practice, and it's a virtual practice by Zoom. And COVID set us up for that, so that I could see more people in different places without having to have my office open. So that's nice and convenient. But this young girl, so when I met this young 19-year-old, I actually had some experience by treating her sister and her parents. So this gal was seemingly healthy. She didn't have any issues. She didn't need to worry about her nutrition, and didn't have any interest. But eventually she came to me because she went into what she then considered an emergency state. She is a beautiful young woman who declared that she was an introvert. She had trouble making friends. During the consult, it was as if she knew she needed to be there during the consult, but she did not want to be there. And so she was disconnected. And I figured it was a teenage disconnection, but it was not so. So I did write down, she yawned during her consult. She was not comprehending my questions. She was very dull, very disconnected, and seemingly uninterested. Her parents did a lot of the talking at that time. She was able to relate to me that she started having seizures. They were quick little seizures that weren't that scary. She's a freshman at university, and her girlfriends were just assuming that these seizures were nothing until she had a 20-minute seizure that the emergency medical services were called, and they couldn't wake her up. She thought that she was going to die. So her parents said, you are going to be on anti-seizure medicine the rest of your life, or you can start working on truly rebuilding your health. And she was resistant, but at this point, with that 20-minute seizure, she now knew she needed to do something. So we took her labs, and her white blood cells were extremely low. Her white blood cell count was extremely low. Her cholesterol was extremely low. And so for me, I thought just that having the cholesterol be that low, that would be one reason for having seizures. And she was severely malnourished and anemic. All of those lead to, a very debilitated state of which she presented. So we put her on a nutraceutical protocol. I flooded her with plant fats, DHA for her brain, and really flooded her to get her cholesterol up. Gave her some iron supplementation and then some other nutraceuticals to start rebuilding her white blood cell count. While I worked on her homeopathic plan and submitted it to Argentum for help. So this is my patient. She's 19 years old. She was raised in a Christian, very conservative home, and she was never out on her own. She was adopted. So she was raised freely, but once she went away to university, she really let loose and started partying, started sleeping, having intimate relationships, and using the morning after pill. Her and her girlfriends were tasting the different flavors of nicotine, the vaping, and she would have alcohol. So now she started having seizures. But the seizures did not come immediately. They came months after this experimentation. But she had her first seizure, as I said earlier. It wasn't really that extreme. She didn't even know for sure if it was a seizure. It was something very odd. Her girlfriend said it looked like you were spitting. You kind of blanked out, but then she came to really, really quickly. So then she moved into a dorm room and she was bullied. Before I said that she came from a very conservative household, and she thought herself an introvert. And so the fact that she was bullied, she was basically, the girls were trying to push her out of the room to get another roommate in and exclude her. And so this really was the start of her sinking worse in her health, in her emotional health, and in her physical health. So in October, she continued having small seizures over a 2-week period with the vaping, with the partying. But then these months later in December, she comes home. She's actually at home when she had this 20-minute seizure, and the emergency services, it was very hard. Her family thought she was dying. So in my summation of what the seizures were, I thought the ailments from bullying was a likely causation, because that's when the seizures really started escalating in the frequency. And the seizures, according to her friends and the people that have seen her, her face would get very red. In the consult, when I talked to her directly, her face would get really red, and then it would shrink down. And so I thought that was very interesting, that during the seizures, her face would get really red. She would get a frightful look on her face. She would spit, convulse, blackout, and her body would twitch. Her health history. She had a history of urinary tract infections, strep throat infections, tonsillitis when she was little, hypotension, scoliosis in her neck, but she had a fall when she was 4 years old that she really never recovered from. And she had a vomiting sickness, what maybe like the flu once a year, and she had vaccinosis symptoms as a baby. She was very high strung and needy.
Mm-hmm.
As a grammar school child growing up, she had brain processing issues, difficulty understanding the written instructions and verbal instructions of her teachers. So they labeled her as slow. And so she always got a little bit of special help in school. She had texture and tactile aggravation with foods and with materials. And as a baby, she threw up the formula.
Gotcha. Mm-hmm.
Her birth mother had history during pregnancy of alcohol, drug use, marijuana, and cigarettes, nicotine, and preeclampsia. She was given up right at birth to the adoptive parents. So the action plan. I was working through the blockbusters. What is the likelihood of how she's going to unfold when we start giving her remedies? At first, I wanted to give her an acute seizure remedy that covered the seizures, covered the characteristics of the seizures, as well as she had some pretty interesting physical symptoms that I took as well. Because she had the symptoms of the high-pitched scream after getting the MMR vaccine, I thought that might be a block in her dullness in her brain.
Yeah.
The tubercular miasm with the strep, and then because of the history of antibiotics for the strep and the UTIs, and the sinus infections, I thought that quite possibly there would be an antibiotic layer that would need to be peeled. And lastly, I was thinking of being adopted and being given away, and the mother never really nourishing her in the womb, but yet doing the opposite of the drugs, the alcohol. And so I thought that perhaps a milk remedy would be in her future as well.
Great. Mm-hmm.
So the first prescription was from the Solanaceae family, and it was nicotine 30C. This is truly the like cures like of nicotine was the etiology of her now moving into the seizures, and here nicotine was the first remedy to address the seizure layer. The sensations and reactions, according to Sankaran, of the Solanaceae family is jerking, spasms, and convulsions.
Mm-hmm.
The passive reaction is fainting, unconsciousness, and stupor. So when I saw this, I thought it was a home run. And then repertorization of the red face, of she had dreams of wolves. She had the wolves were scary, fighting, and her dreams were crazy. They were just out of control craziness. Her nervous system, I repertorized convulsions, remedies in general. I took the modalities of tobacco aggravates, because this is the first year of debauchery with alcohol and intimacy with her relations and morning after pill. I took debauchery, restlessness, nervousness of her mind, fatigue, malaise. She said that she was always tired, always exhausted, and rubbing and massage ameliorated her. When she was home, her parents would massage her. So this really didn't bring me to where I thought we needed to go, except for I saw the hyoscyamus,
Yeah.
and that's
And I
kind
can
of
see the
what.
belladonna as well in the third.
Oh, and the
Remedy.
belladonna, yes,
Correct.
and the belladonna was right there. And I came to the Solanaceae family, but in Sankaran's book, it didn't have nicotine in it. And so I was looking at an acute remedy of belladonna. And then, I mean, that's really where I was going to start from, or I don't even know if I can pronounce it, atropine, for the suddenness of the seizures. But with Shilpa's tutelage, this is nicotine for the nicotine, and it came out perfectly. So
So
4
this is
months
very
later.
important, Marchon, just for people who don't know, if you go to the slide before that, where you have the full repetition, this is quite interesting that, even if this is for people who think, why nicotine, why not belladonna? Even if Marchon had given her belladonna, because she came to these remedies based on her basic repetition, and then you can see belladonna and you can see hyoscyamus, two of the Solanaceae remedy coming up in the first 8, 10, 12 remedies. And when you have multiple remedies coming from the same family, you are basically using all of them on equal ground. And then you are differentiating them based on your understanding of, the family, or, any other differential diagnosis that you do. And if Marchon had given her belladonna, it would still be a good prescription and the right prescription. Nicotine came up just because her mom had a history of nicotine abuse. She had a history of nicotine abuse, and nicotine is an alkaloid of the Solanaceae family. So we were like basically trying to have two-pronged system here. One is the Solanaceae understanding, but the second was the understanding of using, like cures like, because she's had not been well since nicotine in that form. So don't worry. If you don't get to nicotine, it's still fine. Even if you use belladonna, it's a good, really good prescription. So that's what I wanted to talk about. Over to you, Marchon.
Well, and that is exactly what you taught us. If we see the same family come up within the first 10 of the remedies, then go there and see what you see. And so that was very exciting to me to see that. So then nicotine matched all of her characteristic physicals, which was lovely. So that was a confirmation. And then her response. So right after taking nicotine, she vomited clear liquid. She had spots before her eyes. She got a UTI. And at that point, I think I added the tuberculinum, LM1.
Marchon, talk about tuberculinum, because it is important. This is a case at stage 2, 3, and you used a remedy in nicotine and you used tuberculinum together. Talk about tuberculinum and what made you think of that.
So the restlessness, which led to exhaustion, the chronicity of the strep infections, the dullness. She was very dull. So, and she was tall and slender, and so I mean, she really just kind of fit. She fit according to her history.
Gotcha.
It did wonders. She then started having monthly doses of nicotine 30C. I had her get a 200C and a 1M, and we never needed it. 30C did the work with tuberculinum LM1, no seizures. So after the dosing with the nicotine, no seizures whatsoever, ever again. Her dreams were still violence, bombing, shooting, chaos. The cholesterol levels improved. the white blood cells improved. So we knew we were going in the right direction. Then energy vitality improved. She started getting bloody noses. So we knew that tuberculinum was doing its, we were tapping into the tubercular miasm. She became an insomniac. It was even more difficult to fall asleep. Her hunger increased, which was really, really good considering she was so malnourished. She wouldn't eat. She just didn't have an appetite to eat. There was a return of old eye-sty symptoms. So I knew that we were on the right track. We were alternating the nicotine with the tuberculinum. We got a reversal of old symptoms, reversal of UTIs. Her skin started getting worse. She started having hot flashes and perspiration during menses, sick stomach cramping, diarrhea. So the flu that she had every year, we started tapping into that. She now is having anxiety meeting new people, or it's coming to the forefront, and she wanted more spicy and salty foods. Then her second follow-up, 3 months later, still now I moved to a tuberculinum 200C. Dreams are calmer. The urinary tract infections are cycling through. She never needed any antibiotics for any of the infections. We just handled them with the remedies. Incontinence. When she was little in grammar school, she would have incontinence with urine, and she started getting those symptoms back of incontinence, sore throat. She started getting sore throats, earwax, the same symptoms as a baby. She would get, her vision started becoming dotted, and she would be super itchy in the shower. So she's unfolding well to lesser disease pattern. So a change of prescription. So the third follow-up, we're seeing that she's stuck. The tuberculinum, it stopped registering. And I think she actually tried it a couple months and it just didn't register. So at that time, she did have sinus infections that she was dealing with, the UTIs that she was dealing with pretty much on a chronic level. And so she was then sexually active. She was getting the UTIs. They were becoming very chronic. The sinus infection was chronic and we couldn't get rid of it. And she got into an abusive relationship. Her self-worth, she was having problems with. She was very, very anxious. She was being controlled by this partner. She was afraid of the dark and that something would kill her. She was sleepless. Her throat would be sore, but it would change from side to side. One day it would be really super sore, acting like it was a strep, and but not with the pustules, and it would change from side to side. These were now chronic and hard to move. So I dosed her with laconinum 30C because of the sore throat, because of the abusive relationship, and knowing that that I was thinking of a milk remedy for her identity, for her nourishment, and the sinus infection. I also looks like I didn't have it here. I also switched her to medarinum.
Yes.
The labs normalized, macronutrients all normalized, everything on her labs came up to lab range normal. It was very, very amazing. So, I didn't put that in there, but medarinum was also dosed, but I think only one time, and it then moved the UTIs, the sinus infection, and the throat infection. All of the acutes moved through. So her mother came back to me for herself, and her report is, my daughter is thriving. She school is so much easier for her. She is working a job now. And then later, when I spoke to my patient, she was fully engaged. She was bubbly and looking at me and fully engaged. So what I saw in the original of the dullness, the lack of comprehension, it was part of the disease. What did I learn from this? Well, like cures like. The causation, the nicotine that caused the susceptibility when she was in the womb also healed the disease process that was running forward. This was also one of my first cases of alternating the nosodes of tuberculinum and metarhinum with confidence, because there's a bit of overlap, and that in order to really remove the blocks for lasting cure, that the nosodes needed to be prescribed. And looking back, the aha, when I took the characteristic physical symptoms, how they just nailed it on the nicotine, which was the remedy to cure her. The impact. So we always want to know that we're making a positive impact. And so looking at what this 19-year-old, the road that she was traveling down, if she took the conventional route, I mean, maybe this wouldn't have happened, but most likely she would have stayed on anti-seizure medicine. And not just one medicine, but when she started having breakthrough, she would be put on another anti-seizure medicine, and it would suppress the disease and push her into a deeper level of pathology. So it's thrilling that she didn't do that. She also, with the state that she was in, she was introverted. Her social circle, she got approval from. And so this would have been a very big stigma for her, having seizures, not being able to drive, not being able to do things that her friends were doing. And quite possibly it would have led her into more drug use and more of a lifestyle that her mother was in.
Correct.
And so what I think the impact is for her, using natural medicine instead of Western conventional medicine, would be that this was a total healing for her with the symptoms that were presenting, with violence, and we were also able to tap into her inherited miasms. I saw tremendous health in her brain, from the dullness to the just being able to connect and understand. We saw her labs go from a diseased pattern to perfectly normal 19-year-old girl. Mm-hmm. So amazing. And so her ability to live a fuller life, to be able to think and learn more, easier, boundaries of self-love, so that she's not a victim and that she values her identity and stands up for herself. I think that this was what, maybe a 6-month period of time that quite possibly redirected her entirety of her life.
Wow. That's amazing, Marchon. What really stood out for me is you kept it so simple, and it's okay to not know what is the next remedy, what is the next step, right? You start with nicotine and, you give it your best shot, but then you see there are 2 miasms coming up. There are, and that happens in complex cases where you have multiple remedies being indicated because it's sort of a complex meshed in multiple states all embedded together in the case. And it's okay to just give it your best shot and start with the miasmatic remedy that you think is coming up. If there are two and you start with one, it's not a problem. You started with tuberculinum and nicotinum, and using the two-prong system, which we always speak about. Don't worry about, this is my final one similimum. No, you have nicotine. That's a good remedy. It worked on two different levels for her. And then you have tuberculinum, your best shot. She has restlessness. She has intense sort of tubercular traits coming up there. They work very well. And then medurinum indications will come up. The body will throw it when the body needs to. The UTIs came up, the whole aspect about the suppressed sexual state comes up, and medurinum does the job, and then the milk comes up. But just what's wonderful, Marchon, is the way you knew that these are going to come at some point. You put those 5 or 6 strategies in place. These are the blocks that I see. These are, MMR never came up, and that's okay. And who knows, it might in the future. This is, it's a 6-month process. It's a work in progress. But in that time, you've given your patient the best potential of homeopathy and your nutritional, and, it's an integrative state. So that's great. Just thank you so much for sharing. And thank you so much for just, making it seem so simple. It was not, but just having and taking those baby steps and just getting it all the way. And the amazing impact you have had on her as a person. So tell me about, with patients in the future with similar things, what do you take away from this case that you would apply in the next case with similar states and similar miasmatic blocks?
My takeaway. So seizures to me are intense. So maybe the simplifying of I think the in learning how to do homeopathy, it is complex, and it's almost for me as if I've had blind spots. I don't know enough materia medica. I don't know enough. But what you just said about the simplifying, and I think what the blockbusters of how you have taught us how to analyze the case, look at the possible layers that may or may not come up, but at least have them down. So when they do come up, you have already in some way thought about it, and now you repertorize the state and you're able to move on without intimidation. For me, I guess it's more intimidation. I want my people to get well in the, the most gentle, rapid healing possible. And so simplicity. This case is definitely a really good picture of simplicity, because we just toggled. We just kept toggling, and that felt really good, and it lended towards confidence of knowing that how the healing is likely to unfold.
Perfect. Thank you, Marchon. Thanks for coming in. Thanks for your time today. And anyone, if you're watching here, give a thumbs up for Marchon, just for putting herself out there and giving her patients the best potential of homeopathy. And you go and get out and give your patients what they deserve and what you deserve with your homeopathy too. Thank you.
Thank you, Shilpa, for inviting me.